Everyone hear me? Okay. Hi, my name is Karhai Chu. I'm at University of Pittsburgh, Graduate School of Public Health. I'm a tobacco researcher. I am a little nervous following Dr. Wolf, not for the obvious reasons, but mostly because I'm from Brooklyn, New York, and I've spent the last 15 years shedding my accent. But when I go home, or in this case, when I hear it, I start speaking faster and the words start changing and the accent all comes back. So I'm mentally trying to keep that under control. So I really appreciate the invitation. I'll just make one acknowledgement that my funding comes from the National Cancer Institute. I always appreciate when I'm invited by healthcare professionals. I talk about tobacco and I really cover a lot of products, but I only will have one slide on cigarettes because I feel at the same time if I'm speaking with health professionals and I need to convince them that cigarettes are bad, it's really sort of a losing battle already. But I will still talk about it just because of how important it is, and then I'll transition and you can see why. Cigarettes are just, you sort of tend to think lung cancer or heart disease, but it causes a dozen different types of cancers. It causes dozens of different chronic diseases, specifically with mouth diseases, oral cancer, gum disease, and tooth loss. For me, the biggest concern is always nicotine addiction, and that partly is because I work a lot in the adolescent and young adult world. So for adolescents, it's very much brain development. Will happen until you're 25. If you're starting on nicotine at 12, you're really endangering yourself, but even all the way up through young adulthood. So now I'm going to switch a little bit into e-cigarettes or vaping, right? And part of the reason is I think there's more new information in this realm than there is in cigarettes. We sort of know what cigarettes do, what problems they cause, and why we shouldn't do it. There's not really an argument. Is there a good reason to smoke cigarettes? But with vaping, and way back when in 2018, it was sort of first recognized as a problem, right? We saw in the National Youth Tobacco Survey, tobacco use had started going up, and it was driven primarily by e-cigarette use in high school, where 77+% of students were using it, and even in middle school, where almost 50% of students had used e-cigarettes. So at about that time is when the US Surgeon General declares youth vaping an epidemic. Then stop for a second, wait, is it really harmful? And one quote I always see a lot, both from vaping companies and tobacco in general, is that propylene glycol and vegetable glycerin, which are chemicals used in most e-cigarette formulas, are considered safe for human consumption and are found in lots of food items we eat on a regular basis. We do not vaporize our broccoli and breathe it in. We do not vaporize our food to breathe it in. So you can already sort of see, this is, to me, misinformation, right? It's very true. And it's presented in a way that seems to be safe when in reality, you're vaporizing these chemicals and inhaling it into your lungs where the danger actually happens. The second part that I really want to focus on, or really put a lot of weight to, is as a behavioral health researcher, the biggest problem we've seen with e-cigarette use is that teenagers are 4 times more likely to transition to traditional cigarettes if you start using e-cigarettes. And 4 is sort of the conservative estimate. The numbers range from about 4 to 8 times as much. And this is where, going back to the cigarette slide, everything falls back into cigarettes, right? Once you've gotten your vaping, once you've become addicted to the nicotine, switching to cigarettes is a very easy next step. So we're moving up to 2019, and what do the numbers say? E-cigarettes are down to about 20% of high school, about 5% of middle school, but those numbers are also a little tricky. I point out the bottom 3 numbers. Current use, which means more than 20 days, right? That's a regular user. You're not trying your e-cigarette once a month, has gone up. Current use in middle school, again, more than 20 days in the past month have gone up. And then this is the weird one, right? Disposable e-cigarette use has gone up 1,000% in high school and 400% in middle school. That's really weird. And I think the first time we saw it, we didn't really get that. But you can sort of see what's happening, and there's a bigger picture around it. So backing up one step, why those numbers I think are also a little tricky is what are we asking in these surveys? And in general, up until about 2020, the surveys have asked, during the past 30 days, how many days did you use an e-cigarette? And when we talk to especially middle school and high school kids after that have taken the survey, they will say, no, we know, Dr. Chu, we know e-cigarettes are bad. I don't use them. I Juul or I vape. But that's water vapor. That's different, right? And that's sort of our first aha moment. We as researchers want to use the correct term. These are not vaporizers. There's no vaporization happening. It's an aerosol. So we use the correct term. It's an electronic cigarette. Kids do not use that term. Nobody's e-cigaretting, right? They're juuling, they're vaping, and amongst a bunch of other types of terms. So knowing that, we knew our numbers were actually kind of low because kids would think truthfully that they're marking, I don't use an e-cigarette, but nobody's following up and saying, but what do you use? How are they seeing this? I mean, it's on social media, right? A lot of my work has become more social media related just because I work with adolescents, I work with young adults, and where's that information? It's much easier for me to go on Snapchat, Twitter, Instagram to see what's going on rather than trying to survey everyone around the country. These are just some examples. That's Sophie Turner's on the left using her Juul on the Game of Thrones set. That had, I think, 4 million plus likes. Right? So this is where it's happening. Bruno Mars, Leonardo DiCaprio, depending on which generation you're from is how popular each of these are. But each of these are sort of normalizing it for adolescents, right? They see a celebrity using it, it's safe, it's fine. There's really nothing wrong with it, right? And tobacco companies are smart. They're not advertising to kids that it doesn't work. It's sort of against the law. But if I've paid celebrities to just take a picture of themselves using my device, that's totally safe and gets to more kids that way as well. Okay, so now I'm going to start bringing back that 1,000%, 400% and what it meant. So on the left are some of the images that Juul has used in their social media campaigns. They're very smart. It's very colorful. It's very fruity, right? These are delicious flavors that you can vape. This is not your traditional cigarettes. Have mango, come have apple, orange flavored, creme brulee, mango. And all of the ads are very colorful. The weird part is, I think, depending on how familiar you are with tobacco background, all of this was made illegal through the Master Settlement Agreement over 20 years ago. Tobacco companies cannot target children. They cannot use cartoons and flavors. We don't have, orange cigarettes anymore. E-cigarettes have the playbook. They literally know exactly how to target kids, and because they've tried to define themselves as not cigarettes, they've used the playbook very successfully, right? Companies like Juul, once they were bought out by Altria, having this billion-dollar valuation, knew that these things worked, and we could see that it does, that celebrities were able to influence kids, that flavors, that cartoon ads were really kind of bringing back this generation. And it's really driven, so when I say in the earlier slide how tobacco use was up, it is driven mostly by e-cigarette use, but it's also because I'd say over the past 20 years, tobacco research has seen this nice steady decline of adolescent cigarette use, and that has leveled off. It's more of a, we'll see in 5 years why that's the case, but we're given the hints, right, that if teens start using e-cigarettes, they will switch to cigarettes. That's sort of that transition that has leveled this off and sort of taken away a lot of the gains that tobacco research or tobacco control has made over the past 20 years. Now, on the right is Puffbar. How many of you are familiar with Puffbar? Okay, there's already some, so that's good. So Puffbar is a disposable Juul-like device. Right? It almost looks exactly like, so you could see the colors, the advertising. They're literally doing what Juul did to become a billion-dollar company. The reason it works is because there have been a couple of mandates and policy changes over the past year and change or so. The age has gone up to 21 for tobacco use, and flavors have been banned with an asterisk to say in order to accommodate smokers that want to quit and also have flavors, we will allow disposable single-use e-cigarette devices to have flavors. So of course, we put that, the policymakers put that in place thinking we're trying to support people quitting smoking. And then we see that 1,000% increase in high schools for disposable products and 400% increase in middle schools. Kids are not stupid. They know how to get products. During the pandemic, they know how to order online. They know that I want my Juul, They can't sell flavors anymore, but Puff Bars can for some reason. I'll get that too. This is I always have to take a deep breath after this, and I'll read it in case it's too small. This was a Puff Bar ad. We know that the inside vibes have been quite a challenge. Stay sane with Puff Bar this solo break. We know you'll love it. It's the perfect escape from back-to-back Zoom calls, parental texts, and work-from-home stress. So now we're not even subtle anymore, right? Use Puff Bar to relieve your stress from parents texting you during a pandemic where kids are quarantined at home, right? It's no longer, we're just going to put in a few colors and see if that's interesting. It's just blatant now. And it's because the law permitted disposable devices to have flavors to accommodate smokers trying to quit. And for some reason, no one thought that kids would think, oh, well, if they still have flavors, I'll just get Puff Bars. And they have. So what's next? I mean, I constantly will say tobacco companies are the smartest people in the room. And I don't even joke. They have more resources, more money than public health does. And they've been doing this longer. So one good example is Puff Bar got a cease and desist letter, right? Because they were obviously targeting kids, even though the law sort of allowed them to do that. And so they said, okay, well, we thought, okay, that sort of solves that problem. And so Puff Bar went back to the drawing board and said, you know what? They're giving us this problem because we're a tobacco company. So instead of deriving our nicotine from tobacco, we're going to create synthetic nicotine in a lab. Now we are not a tobacco company. And as demonstrated, our nicotine-based products have a specific manufacturing process, not from tobacco. So please don't talk to us, FDA. We are not a tobacco product. We have nicotine in our product, but we created that ourselves. And therefore, we are not beholden to you or any of the laws that you want to come up with. And this is sort of, again, it's a very cat and mouse game, right? Tobacco companies come up with a way to get around certain laws. Public health comes back and says you can't do that. Then they just come up with a new way. And synthetic nicotine is the current newest way to do this. It's very annoying as a tobacco control researcher to have to constantly sort of do this. And a lot of these, most of my data comes from kids on social media. I don't, it's not like I can just search every e-cigarette company's website to see what the latest trends are. It's really somebody tweeting, hey, how do you get a Puff Bar? Hey, do they deliver? Do they ID if they deliver, right? And that's where really I get a lot of my information. So is there any hope? So I will say that as a public health researcher in general, specifically looking at tobacco, my surveillance data, aside from social media, comes from really three sources from my colleagues. One is teachers, which is how I get my work with prevention in schools, with pediatricians in pediatric offices, which is sort of where we got our idea that kids are saying they know there's a difference between e-cigarettes and Juul, or they think there is. And at dental clinics. I surprisingly work with colleagues in dentistry that, again, are really frontline and have more information that I would normally see just doing research on my own. And I think that's where the surveillance part is important. And I say this because with vaping, a big question I get asked is about the health effects. And I've pointed out nicotine, I pointed out a lot of the chemicals that are used, and being so deregulated, there's no list of ingredients in every flavor. There's over 15,000 flavors, most of them are homemade. You don't know what's in them until you've put it in your lungs and figured out if that's a problem. The other tricky part with vaping is that it got introduced into this country at 2007. It didn't really get popular until about 2012. Juul came around 2015, 2016. What that's to say is, if we invented cigarettes in the same time frame, right about now, we'd start seeing some health effects, that maybe there's emphysema, maybe people are coughing more. We don't have this huge cluster of lung cancer, of oral cancer, of all the other ones yet, right? Those are more, we're looking at 20-year smokers, 25-year smokers, and with e-cigarettes, we're literally at 14 years, but I'd say maybe less than 10 of popular everyday usage by adolescents. They are literally the first cohort, and we will know what 20-year effects will happen in about another 5 to 7 years. So the surveillance has become so important at this point because, number one, that it's so new, even though it's been out for a while. And number two, Because it's so destandardized. There is no one, this is not tobacco leaf rolled in a certain way with certain things mixed in. This is, I can make my flavor at home and just sell it at the store, right? And that's why I really harp on the surveillance part of it, because it's being able to speak, for me, understanding the adolescents and young adults, but I think across the board of people who use e-cigarettes, that's really trying to figure out, okay, what is happening now? At the community level, so that sort of reinforces the point that I'm making. A lot of my work is with colleagues in dental clinics, in pediatric offices, and those are really where I constantly talk to them and say, do you ask them about tobacco use? If you do, how do you ask that? What are they saying? How often do they use it? What are the misconceptions? Wait, what is Puffbar? Who's telling you about this? And then I have to sort of look it up. And that's where the information is coming in. I think surveillance at the community level is really what's going to drive finding out the health effects of e-cigarette use over the next 5 and change years. At the county level and federal level is more about policy. And it's weird that I've become a social media expert because I work with adolescents, and now I've started learning all about law just because of seeing how tobacco companies are able to circumvent so many laws. And I think that's important because it's more not just kind of going to state capitol and holding up a sign, but really understanding why are kids using puff bars. And it really took everything being tied together. Here's a new product. It looks like this old product. It's disposable. Why is there a 1,000% spike? Oh, the law allowed this exemption. It's flavored. We go back to the kids. And it becomes this like, okay, you really can't understand the problem until you see the entire bigger picture. I felt like I talked very fast. Did I talk? Because I'm not getting my 1-minute warning, so I will just end that and say, thank you, this is my contact information.